going to start with specific aspects of the anatomy of the muscular system. So here we have the distinction between the axial and the appendicular musculature. So axial, just like it happened for the bone, we discussed for the bones. Axial are the muscles that position the head and the vertebral column, and also the ones that move the rib cage. Whereas the appendicular are essentially muscles that either stabilize or moving the limbs. We'll start with the muscles of the head and the neck. So starting with the muscles of the face. So here it is just the big picture of the muscles of the face. So the challenge here is that there are several muscles in the face. So that's already a good thing, to be aware of the number of muscles of the face. So we may not notice, but if you take, for example, a series of selfies of you, you'll see that they are all almost different from one another, and so we can produce many facial expressions. We do that thanks to the great number of muscles in the face. So that's one aspect to have in mind. The second aspect is to try to go through these muscles from a big picture into then a smaller picture. So your challenge here, this is absolutely important that you know the muscles that are represented here. So you have the scalp, which is that white portion, and the muscles, so all the what covers the cranium, if you will. And then you see two circular muscles here, the orbicularis. Both of them are called orbicularis because they are sphincters, they are circular, but one is oculi, so for the eyes, and the other one is oris, for the mouth. You can come back to this picture and try to label several of these muscles again. So in a more detailed group, it's important to know that we can divide these muscles into orbital, nasal, oral, and a varied group that we'll call other muscles. You don't need to necessarily know this division. It just helps us from the point of view of learning to know which one is what. So the orbital group has the orbicularis oculi, which you see there very clearly, is a large muscle that will open and close the eye. And then you have a muscle that you would see only if you dissect the orbicularis oculi. So you remove the orbicularis oculi, which is the corrugator supercilii. The corrugator supercilii is a muscle that helps frowning, whereas the orbicularis oculi is a muscle that closes the eyelids. It has two portions, one is orbital and the other one is the palpebral part. So pay attention very closely to the slides, because the slides and what I'm saying is helping you navigate through these muscles. Otherwise, the number of muscles you have to memorize is considerably high, but you don't have to know all the muscles with the same detail. Okay, so I'll be giving you the detail and information as to what you need to memorize about each muscle. So pay very close attention to that. The nasal group, we have the nasalis, which is a muscle that surrounds the nasal part, so the nose, active when the nares, so the openings to the nose, are flared. The procerus, which is a small muscle that is superficial to the nasal bone, and it also helps frowning. And then a depressor septi nasi, so a muscle that is a depressor of the nasal septum. So these are the three muscles that act on the nose. So the big muscle of the cheek is the buccinator. The buccinator forms then the muscle component of the cheek, and it's used every time air expands the cheeks. Expanding the cheeks is forcibly expelled. So if you're playing, for example, an instrument in which you have to blow into the instrument, you're using a buccinator. Another one is the orbicularis oris. So orbicularis, a sphincter muscle, oris, oral. So a muscle that will be important when closing the lips. For example, if you're whistling. So both the buccinator and the orbicularis oris are so in a way that we're closing the mouth, but there are other muscles that open the lips. And here we have, pay attention to the names, because the names do help you. Depressor anguli oris, so the depressor of the angle of the mouth. Depressor labii inferioris, so the depressor of the inferior lip. And the mentalis. So I'm not hoping that you are able to identify all these muscles. You have to pay attention to the big ones, the ones that you can easily see in a diagram, but you have to have an understanding where those muscles are. For example, imagine a multiple choice question. I ask you, where do you find the mentalis? And I give you a couple of options, and one would be, for example, in the face, and that would be the right answer, or more specifically in the face, inferior to the lip. So that is the kind of knowledge we are going for. The upper group of muscles, we have very much the same kind of knowledge, just the notion they exist. The names help you tremendously know where they belong, to what group they belong. So pay attention to the names. Levator anguli oris, so the muscle that elevates the angle of the mouth. Levator labii superioris, so elevates the superior lip. And you have one that is echinaceae. Then there's the zygomaticus minor and major, which are these strips of muscle that you see there. And the risorius, which helps with the grin, produce a grin. Okay, so this is pretty much it. So as far as the several number of the different muscles of the face. So it would be a good moment for you to just look at a picture like that, this, for example, and see if you identify. So I'll be testing you on the biggest muscles, the largest muscles of the face. So the ones that are more visible. But you have to have an understanding if you hear a name, for example, if you hear, let's say, the corrugator supercilii, what is it for? It's to corrugate, it's to frown the forehead. Other groups of muscles are the platysma. The platysma is this large muscle, very thin, that is superficial in the neck. So it's basically tensing the skin of the neck, for example, when a man needs to shave. And then you have the auricular muscles, the muscles that are variable, but they produce some movement as to the ear. Finally, we have the occipitofrontalis. The occipitofrontalis is the muscle that will allow a continuation from the forehead all the way to the occipital area. But in the middle of this, there's no muscle, but there's rather an aponeurosis. So you have a frontal belly and an occipital belly. And between connecting these muscles, we have aponeurosis. The occipitofrontalis muscles move the scalp and allow some wrinkling of the forehead as well as raising the eyebrows. Okay, so these are the muscles of the face. So pause here if you see fit. I cannot tell you which ones you need to know for sure because the goal is that you know them all. But the goal is again to know them to the extent I spoke, I told you about. Okay, so we have a lot of muscles to memorize. We will not be able to know all the muscles to the same extent or in the same detail that we know other muscles. So you will pause here as you see fit. I will proceed to expand on the extraocular muscles. So the extraocular muscles are muscles that are extrinsic to the eyeballs and will move the eyeball or the eyelid as well. The names of the muscles is very simple, and so is their function. But what you need to do here is to really know the position of the eye. So you have to understand what is medial, what is lateral, what is inferior, what is superior, what is anterior or is posterior. So in the picture, for example, B, you see the nasal bone. So you see that you're seeing the eyeball from the lateral side. You also see the frontal bone, and so you see that above. So you see that what is superior in the picture is superior in the body, and what is inferior in the picture is inferior in the body. So once you have that information, it'll be relatively easy for us to know all the names of the muscles, because you have muscles that are superior, muscles that are inferior, lateral, and medial. So what you're seeing at this point, for example, closer to your eyes, would be the lateral rectus, a muscle that is rectus. You see an inferior rectus. You see a superior rectus. Okay? If now you see from above, you continue to see the lateral rectus, but you also see a medial rectus. And you also see a superior oblique. If you go back to the B picture, you'll see the superior oblique again from that perspective, and you also see the beginning of the inferior oblique. Okay, so pause here as you see fit, but perhaps it's best to continue and then come back to this picture. So the first muscle is the levator palpebris superioris. So a muscle that elevates the superior eyelid is a muscle that is not represented in, is not clearly seen from the outer part as of the face. So you see here the eyelid, and you see how it projects to the eyelid, and you see in picture B what it looks like. So this is the muscle that you see on the very top of the picture. Okay? So a muscle that is important to elevate the eyelid. So you will be essentially opening the eye. In relation to the rectus straight muscles, so you have, again, this is very, very simple. They all come from a common tendon ring. So that white part on the back is the common tendon ring. And then you see that they are all straight, and their position is really for you to basically, the position tells you the name. So again, this is the same picture as shown before. Try to spend some time in which what is medial, what is lateral, what is superior, and what is inferior. And the naming is very clear. So you have superior rectus, inferior rectus, medial, and lateral rectus. So use the nose to indicate what is medial, and the rest as lateral. And what is closer to you at this point is lateral, and above would be superior and inferior. Below. Okay, then the oblique muscles are two muscles that are oblique, so they attach to the eyeball with a certain angle. So you have a superior oblique and an inferior oblique. So you see here the superior oblique that passes through the trochlea. This is important because then you learn in the bones, when it comes to the nervous system, that the trochlear nerve innervates the superior oblique. And if you remember that the superior oblique tendon crosses the trochlea, it will be important and projects to the eye, attached to the eye laterally. So the movements of the superior oblique and the inferior oblique are not very straightforward, but I'll explain those movements to you in a little bit. For now, just worry about seeing if this muscle has an angle. It is on the superior side. We're talking about the superior oblique. The inferior oblique does an equivalent trajectory, in the sense that it also has an angle, but so you see them, but it grabs the eye also from the lateral side. So it's attached to the eye from the lateral side. Okay? So it is really at that point really under the lateral rectus. You see attaching there, one attachment. Okay? That's the inferior oblique. Okay? So you have these, your goal is to identify these muscles in a picture like this, or in another picture that I've showed you. That this one, so pay attention, if you're seeing a superior view, it would be very difficult for us to see at this point the inferior oblique. And here you see all the muscles, including the attachment of the inferior oblique onto the eye. So to organize these movements according to each of the muscles, so it's very straightforward for the recti muscles. So the lateral rectus is going to move the eye out, what we call abduction, just like we say abducting the arm. The medial rectus will turn the eye in, so we're talking about adduction. The superior rectus elevates the eye, and the inferior rectus depresses the eye. As far as the obliques, they both turn the eye out. In the case of the superior oblique, is out and down, so laterally and inferiorly, and the inferior oblique is down and superiorly, upward. So it's the opposite. Their position is superior. The position of the superior oblique is superior, but in fact is moving the eye down. The position of the oblique is inferior, but the inferior oblique is inferior, but the eye is pulling up. So clinically, you have to test all these movements. You end up doing an H. So you ask the patient to follow a pencil or your finger or another object, and you're going to draw an H up in the air, and so that the patient follows in all the possible directions. So up and down, medial and lateral. Okay, so here's a good time for you to pause and see if you understand all these muscles. Then you complement these muscles with the nerves when we reach the cranial nerves. So we're moving to muscles of mastication when you are ready. Here it's very important to know the function of these muscles and the big picture of the muscles. I'm not interested in that you know all the insertions and origins of the muscles, but rather to identify them. So the big muscles of mastication are the masseter and the temporalis. So these are the two big muscles. So you see the temporalis covering the temporal bone. You might have noticed what we call the superior temporal line. Does not only cover the temporal bone, but it covers also the frontal and the parietal. And then you have the masseter, which is a muscle that you feel on each side of the mandible. In addition to these two big powerful muscles, you have the medial and the lateral pterygoid muscles. Okay, so this could be your summary here for this section, but so we are going to move forward and then you can come back here. So pause if you are just if you want to just give have already a view and a memorization, a diagram of the muscles when we're going to move forward.
The origins of masseter are from the medial surface of the maxilla and the medial surface and inferior border of the zygomatic arch. The insertions are to the lateral surfaces of the angle and ramus of the mandible. Masseter closes the jaw. It is innervated by the mandibular branch of the trigeminal nerve.
So for the muscles, I have the help of these videos. And these videos have more information that you need. So what basically happens, you have to really pay attention to what I'm saying so that you know what is going to be tested. Because you can have different kinds of level of anatomy. You can have an anatomy that is much more advanced than an anatomy you go for. And so these videos fit that purpose too. One aspect, do not worry about the pattern of innervation for now, although you can start memorizing that if you want. So after each video, I'll show you in words what the video says, so that you have again a sense of what is needed. So what I'm trying to get here from you is not, you have to have an idea or where a fair idea of where the muscle is coming from, so the origin insertion, for you to be able to understand the movement. But I'm not going to be asking you about all these origins. You note that the small font size is showing exactly that. That part is not very important. But if you imagine that this muscle is almost a band that comes up from the maxilla and then down the mandible. So once this muscle contracts, it closes the mouth. So it basically elevates the mandible. And you now can say, you also hear how there's one aspect of these superficial muscles very helpful, is that you have them. So how do you feel this muscle in your body? You try to oppose its movement. For example, but with certain you have to be gentle, because a lot of us have issues on the temporomandibular joint, so you don't want to force too much. So if you apply a certain pressure on your chin, and now with your mouth open, and now to close your mouth, you'll see that the masseter muscles start tensing. So as they find more resistance, they tense more. Okay, so this is your big elevator on the mandible. It's called a masseter. The temporalis is also a muscle that will elevate because it comes from above in what we call the temporal fossa, and is going to insert in the coronoid process of the mandible and the ramus of the mandible. So it's a muscle that attaches the mandible with a certain angle. So not only elevates the mandible, but because it comes from behind, allows the mandible to retract and even to participate in some side-to-side movement. So if you try to close your mouth, like clench your teeth, you'll see the tension. You can palpate with both hands the masseter and the temporalis to a certain extent. Finally, we have the two other muscles, which are the pterygoids. You have the medial pterygoid and the lateral pterygoid. So the medial pterygoid participates in elevation and side-to-side movements of the mandible, and the lateral pterygoid allows protrusion and side-to-side movements of the mandible. Okay, that's pretty much what I would like to know about the mastication. Again, if you focus on what I say, you be exactly preparing for the exam. However, it's up to you wanting to know more or less, and that's why the slides have more text than you need, and that's why I also add these tables. These tables are not for you to memorize, nor no one memorizes, or it's very difficult to memorize information based on a table, but it's good to compare certain things. Imagine that you forgot what the functions of the muscles are. You come here and say, okay, masseter elevates the mandible, temporalis also elevates, but it retracts and participates in side-to-side movements. Pay attention, even if I'm not asking you to know the origin of the insertions very well, to have an idea where they come from. It will be very helpful for you to understand what movements they perform or they help performing based on the orientation of the fibers, for example. And the medial and the lateral pterygoid, which these ones do basically, they both contribute to side movements, and where the medial elevates and the lateral protrudes. So these tables are very helpful to compare the movements. Okay, so I went with a certain speed because I do want you to understand that these muscles are not the most important for our exams. So you expect 1 or 2 questions about these muscles. So there's much more to know. But again, focus exactly on what I said. Okay, we're moving to the muscles of the tongue. So, as it is the case in certain anatomical structures, the anatomists define the root of the tongue, which is where the tongue is attached, both to the mandible and to the hyoid bone. And then the tongue continues having a posterior part, which is in the back of the mouth. We'll call that the pharyngeal part. We'll go at some point, we'll talk about digestive system and we talk about the pharynx, but for now just let's keep in mind the pharyngeal, the pharynx, as being part of the throat, and then the oral part, which are the anterior 2/3 that end with the apex of the tongue, which is basically the tip of the tongue. The tongue is a very heavily muscled organ, so it has extrinsic muscles and intrinsic muscles. Intrinsic because they are part of the tongue itself. Extrinsic because they are attaching the tongue to other parts. So the intrinsic are relatively simple. We have superior longitudinal and inferior longitudinal muscles, and then a vertical and the transverse muscle. The extrinsic all have the word glossus, which stands for for tongue, glossus, tongue. And so palatoglossus, styloglossus, hyoglossus, genioglossus. Here, the point here too, I'll show you a picture to indicate all these muscles, but the point here is not for you to know where their origin is, their insertion is. even their movement is just to simply identify that if someone talks about the palatoglossus, you know that this is an extrinsic muscle of the tongue. To visualize the extrinsic muscles, they are then making the tongue move out of attachments outside of the tongue itself, so they're extrinsic. So the palatoglossus go up to the palate, styloglossus go to the styloid process, genioglossus go to the mandible, and the hyoglossus go to the hyoid. So these are the four external or extrinsic muscles. Again, do not worry about what type of movements individually each one of them does, but worry about knowing if someone asks you, where is the hyoglossus? You have to understand that is an extrinsic muscle of the tongue. The movements of the tongue are pretty much comparable to the mandible to a certain extent. So you can depress the tongue, you can elevate the tongue, you can protrude, sticking the tongue out, or retracting the tongue. Okay? So very simple, just basically know the names. Let's move to the muscles of the pharynx. So the muscles of the pharynx are constrictor muscles and longitudinal muscles. Constrictor are circular, they constrict the pharynx, and the longitudinal are vertically oriented. The constrictor muscles are named after their position, superior, inferior, and the one in the middle will be the middle. What is very, very important that you know is that the constrictor muscles are muscles that will contract sequentially to propel the bolus of food, so the chewed food, the food that we just chewed and swallow, through the pharynx into the esophagus. Okay? So I said the food was just swallowed, but they actually, what they are doing is helping us swallowing. The swallowing is the movement of the food from the pharynx into the esophagus. Okay, the chewed food is called the bolus of food. Okay, so I'm constricting up, middle, down until the food propels down into the esophagus. For pure reference, you have here what they are, but this is clear reference. You shouldn't be worried about the attachments of these muscles. The longitudinal, but I just want to go back, but for example, the innervation, it's important to, when the time comes, to understand that the throat muscles are innervated by lower brain stem cranial nerves, and the constrictors are innervated by the vagus. But just, if there is space in your memory now to start thinking about it, if not, when the time comes, that will be more clear. Longitudinal muscles are muscles that run longitudinally. They are named according to their origins. All you need to know is, like in the mouth, know that they exist. So stylopharyngeus, from the styloid process. Salpingopharyngeus, the salpinx represents a tube. So we've talked about a pharyngotympanic tube, or eustachian tube, a tube that comes from the middle ear to the throat. And this is a muscle that allows some of that movement. This is called salpingopharyngeus. And the palatopharyngeus comes from the soft palate. So all you need to know is that these muscles exist. So if I put a muscle like salpingopharyngeus, ask you what part of the body it is, you have to know that is the pharynx. What is the goal? The goal is that you have at least a certain knowledge that you're not going to ask someone where the salpingopharyngeus is. If you hear that word, you know that is in the pharynx. So, and that the name is saying everything. So all you need to really have is to some awareness, drive your awareness to the names of the muscles. For reference only, you have here the muscles. You see the functions, elevating of the pharynx is a common function among the three. Okay? So you see that there are many muscles here, so we're trying to cover them all, but again, it's not for you to know them with in all detail, in all possible detail. Just focus on what I said. So muscles of the neck. So important to know the muscles of the neck are the boundaries between the of the neck. So there is one muscle that is sternocleidomastoid, which you see there, comes from the sternum, the clavicle, and the mastoid. This muscle forms a boundary in the neck that separates the anterior triangle from the posterior triangle. And clinically, these triangles are important because there'll be pathology of the anterior triangle and pathology of the posterior triangle, lymph nodes in the anterior triangle, lymph nodes in the posterior triangle. But I like to classify, use a certain more organizes the muscles using also these triangles. So I'm going to speak about the muscles of the anterior triangle. And you have here the muscles of the anterior triangle. They're suprahyoid muscles and they are infrahyoid muscles. Let's go start with the suprahyoid. The suprahyoid muscles, you have to know their names. Just like in the tongue. Know that they exist and know that they're part of muscles that are above the hyoid. So the name says it all. Stylohyoid, so from the styloid process to the hyoid. The digastric, which has two bellies. The geniohyoid and the mylohyoid. Geni stands for the mandible. Okay? And then you have the mylohyoid muscle. Okay? And that's pretty much it for the suprahyoid. Just know the names. The infrahyoids are muscles below the hyoid. You have the omohyoid, the sternohyoid, the thyrohyoid, and the sternothyroid. So hyoid is the bone, thyroid in this case would be the thyroid cartilage. Okay? So again, not very much detail, but of course if we go to the suprahyoid, you know that they elevate the hyoid. It's one function. They have more, but one function we can all memorize, and it makes sense. They are above the hyoid, so they elevate the hyoid bone, and the infrahyoid will depress the hyoid bone. And we are good here. Again, I know that I'm going fast through these because, in fairness, all you need to know is the name. So pause here. Just practice the spelling, organize, write down. If you are not going to use the slides, write down, practice your spelling, and try to see them at least once or twice if you can identify these muscles. But you are not going to be asked to identify them. You'll be asked simply to be able to know, if you hear the name, what's the part of the body. Okay. Let's go to muscles of the posterior triangle now. So here you have to know a little bit more than just the names and their functions. So pay very close attention to what you are expected to know for the exam. First is recognize the name. So we have to understand here in this picture already helps us understand and visualize some of the muscles. So the sternocleidomastoid is there, the trapezius, your back muscle. And then you also have access to some muscles that will be better seen once we remove both the sternocleidomastoid and the trapezius. But you see the levator scapulae, the posterior scalene, the anterior and the middle scalene, and the splenius capitis. Okay, you can pause here, but you can also just go forward, and then we come back to a picture like that to see if we already know how to visualize the bones from this perspective. So the sternocleidomastoid, so here it's important to know, I'm not interested that you know if it's an origin or an insertion. Again, that's a detail that we're not going to go for in a course like ours, but you have to know their attachments in general. So we're talking about the sternum, we are talking about the clavicle, and we're talking about the mastoid. In fairness, this sternocleidomastoid has two heads. One that is a sternal head that is going to attach to the sternum, to the manubrium, and another head is the clavicular head that attaches to the clavicle. The movement allowed by this muscle is somewhat like many others. Is so individually they one on its own. This muscle is able to tilt the head toward the shoulder. Okay, so by rotating the head to turn the face to the opposite side. Okay, so you're tilting the head towards shoulder on the same side. If you use them together, they can draw the head forward. Okay, so if you have to try to touch with your head to your shoulder, the same size, you're basically using the sternocleidomastoid. It's a good exercise. If you're trying to isolate the muscle, why don't you do that? Try to, with your head, touch the shoulder on the same side, and you palpate that belly of the sternocleidomastoid. If you protrude, if you draw the head forward, you are also able to palpate the sternocleidomastoid. The scalene muscles are three: the anterior, the medius or posterior. You can call it scalene, you can call it scaleneus. Note that these muscles are different in terms of their attachments. The anterior and the medius attach to the first rib, whereas the posterior attach to the second rib. This is an important distinction here, because and so you should know this distinction, and you should know that the anterior and the medius act on the first rib, elevating the first rib, whereas the posterior acts on the second rib, elevating the second rib.